And this is different than anything, any clinic around.
Workouts that are tailored for her, and that really makes a difference.
Really personal. I've gotten way more mobile, stronger, flexible. Just everything just improves me to the next level.
Welcome to the On Cue Performance Therapy Podcast, where we push sports performance and physical therapy to its apex. We change the game by bringing together the brightest minds in the field to offer best practices and question how things are done today. I'm your host, Mike Quintans, physical therapist and expert in sports orthopedics. I'm living my dream and opened a clinic that unites all elements of sports medicine under one roof to drive recovery and performance outcomes. So I'm a physical therapist at my first office, and there's a PT fresh out of school. I'm like a year out, but there's fresh out of school. And he introduces himself to a patient, his like first patient ever, as Dr. blah, 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 blah. But you can call me Tommy. And the patient's reaction was like, okay, Dr. blah, 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 but let's go. And it started. And I like was elbowing my clinic director. I was the assistant at the time. Like, did you just hear that? He just introduced himself as Dr. First name, last name. And he was like, "That I'm not okay with that." I said, "Yeah, me neither."
Huh.
And it's weird because, yes, we have a doctorate degree in physical therapy, right? I did 4 years of undergrad, got a bachelor's degree, an extra 3 years, and got my doctorate degree. But we're not physicians. We're not physicians. And that's why there's like this weird, feud. I don't know. I feel like it's a tension thing between physicians and physical therapists that identify themselves as doctors. Because the reason, what I hear the most is it's confusing to the patient. It's confusing to the patient when you identify yourself as a doctor because you're not at the same level of medical expertise.
You're not an MD.
I'm not an MD or a DO.
Right.
Right? So I think in some ways it makes sense to me, and I think the less confusion, the better. Like chiropractors call themselves, Dr. Tom or Dr. Chris or whatever. Yes, you're a doctor of chiropractic medicine. Is that confusing? Can you order imaging? Can you order medications? Can you do everything that a physician does? Have you trained as long as a physician? Now you have doctors that are professors, right? They have PhDs. They can't order imaging. They can't order medications, right? So the word doctorate is an expert in a specific field. Physical therapy has worked very hard with lobbying and the politicians, all that stuff, right? In state legislature and federal, really, to be called doctors because we're experts in movement and assessing and analyzing and progressing movement. So should we call ourselves doctor? I feel I've had patients call me doctor. I feel a little uncomfortable when someone says, "Hey, Dr. Mike, like what can we talk about today with respect to my shoulder? How can we get into that?" I don't know how I feel about it.
Here's the thing. You have a very different relationship with your patients than an MD or a DO would have with their patients, right? You see your patients 1, 2, 3 times a week for months sometimes, right? When I was your patient, I was here for almost a year, going from, right after post-op to my rehab to right into sports performance, right? So you have a very different relationship with your patients than a normal.
Are you saying the formality of it's gone?
Right, because I think the trust is there. The trust is like, hey, like Dr. Q or Mike or whatever I call you, like he's my buddy, like he's looking out for me. The physician, they,
see it as like infringement, like they're coming onto my territory. Why are they calling themselves that? I think a lot of it's ego on both sides. Like someone told me recently that physical therapy schools, new grads, or during the graduate ceremony, like there's a white coat ceremony, like they have, like physicians have, like DOs and MDs.
PAs do that too.
I don't know how I feel about it. I feel like okay, everyone stay in your lane. Like I'm a PT. Yes, I have a doctorate degree. So does a pharmacist, right? Pharmacist has a doctorate degree. Are you calling a pharmacist doctor? Maybe
Right.
you are. I don't know.
That's a good point.
Right? Can they write prescriptions? Not in Pennsylvania. Right? So can they order imaging? No. PTs in the military, they can order imaging. FYI, for those who are wondering. But
Fun fact.
But I'm not sure how I feel about it. I feel slightly uncomfortable when I'm addressed as such. I think it's a sign of respect when a patient says that. But I also am super aware of relationships with physicians and how, the physician, they call the shot. If they tell a patient to stop going to therapy, there's a good chance that patient's going to stop going to therapy. And we all need to communicate and be on the same page, right? Same stuff as before. But, what are your thoughts on that?
No, but again, it all goes down to trust, right? A patient is going to trust you because they see you all the time and they get to know you and they get to know your quirks. A patient is going to trust an MD or a DO because they are the elite, right? They are the doctor. Everyone has to trust their doctor. At least that's what we're taught in the American culture, right? Where, there's an argument of, hey, there's been this huge push for patients to advocate for themselves and not just go 100% with what this one doctor says, right? So I feel like there's been different kinds
of shift.
There's been ebbs and flows with that, right? Yes, you're going to trust your doctor 100%, but it's always smart to have your own opinion and do your own research, get that quote unquote second opinion. So I think it's different kind of relationship is my point,
Sure.
right?
Oh, yeah. I mean, there's a shift going on in medicine. We're talking about title. How do you identify yourself to your patient without, if that patient goes back to Dr. Smith and says, hey, Dr. Smith, I saw Dr. Mike, and he told me to tell you this. How good, how's Dr. Smith going to take that, right, regardless of the message? A PT is identifying himself as doctor to tell the other doctor something. I don't know. It's something I'd rather not mess with too much. But listen, your PT advocates out there, and I'm as big as they come, are going to be screaming at the top of their lungs when they listen to this, because they're going to be saying, "Who's this guy not advocating for PTs and not identifying himself as doctor and not wearing a white coat to his graduation ceremony?" To me, it's about I'm confident in my abilities and what I can do, and my relationships with physicians to know enough that my words carry weight when I speak to them, or anybody else, not only physicians, but that's whose toes I would be stepping on, in air quotes, that I can have those conversations with physicians and I can come across the right way, and I know how to use my words to get my point across and what I'm seeing. And in the end, I do want their opinion. I want them to understand my perspective, and I hope they have ideas. Right? Like, that's what this is all about. Maybe they have a different idea. Wow.
Yeah.
How about that? A different idea. Maybe I should listen and adapt and use some of those ideas to help the person get better.
Right.
That's what it's all about in the end. Forget the titles. And that's important because that can ruin a relationship off the jump. Right? And that's why I do physical therapy, really. It's about relationships and helping people accomplish their goals. I could make money doing other things. But I enjoy the relationship component of it with working with other professionals like physicians. So if it means I don't call myself Dr. Mike, which I'm uncomfortable doing anyway, then so be it. Not going to hurt my feelings.
Well, here's the thing too. You were saying that, some people say that it's confusing to the patient when you or a PT calls themselves Dr. So-and-so, right? At the same time, I think it clarifies things, right? Because probably the reason that they call you Dr. Mike is because they don't want to offend you, right? They know you got your doctorate. They don't want to offend you, so they are going to call you Dr. Mike, right? A good buddy of mine, she went to I think it was a midwife, and she was like, I didn't know what to call her. I didn't know what to call her because I didn't know if she had her doctorate. Does she go by doctor? Does she have her doctorate at all, right? So do I just call her by her first name? So I think it's confusing on the opposite end, for patients, because it's not tattooed on your forehead if you have a doctorate or not, right?
That's a
if
great
you're
point.
in medicine, if sometimes, my husband, he works at the hospital, University of Pennsylvania, and he's a EEG technologist, right? He measures brain waves. He does all this stuff. He's absolutely not a doctor, but people call him a doctor all the time because he's in scrubs, right? And he feels uncomfortable. He's like, no, right? So I think
The term of respect is what you're saying. People want to address
Exactly.
you with respect, just like you would a teacher, Mr. and Mrs. You don't call them by their first name. I get that for sure. An 8-year-old would come in here and I would tell him, call me Mike.
But the debate here is, does the PT, does the, doctorate in philosophy call themselves Dr. So-and-so, right? And not that I'm equating philosophy and PT, but, it's a similar, argument.
Here's my final judgment on it. And you make some very good points. Physical therapists with doctorate degrees in physical therapy have earned the right to call themselves Dr. Mike Quintans. With that being said, we have to be aware as physical therapists, we have to be aware of how our relationships are built in order to not fracture or damage. However, others need to be aware too, right? That we have earned that right. The clarification comes when we communicate with our patients.
Right.
Yes, you can call me Dr. Mike if you'd like. I'm not a physician. I have a doctorate degree in physical therapy. Here, this is what I can do for you. Okay, then you clear the air. Everyone's on the same page. But then that also needs to be communicated to the physician, because when the word gets back to the doc that you're calling yourself doctor, you might offend them. And you know what? Maybe screw it. Who cares if you offend them, right? Like, I'm my own advocate. I can see a patient off the street. They don't need a patient does not need a prescription to do an evaluation and, depending on the insurance, further treatment with me. So with that being said, I've earned the right to do that. So maybe, I can flex a little bit and say, you can call me Dr. Mike. I don't know if I'm there yet. That's just not my personality. But to the ones that do, good for them, as long as we're being clear in what we can do and what our limitations are.
Absolutely.
Final verdict.
That's
a wrap. That's a wrap.
Thanks for listening to the On Cue Performance Therapy Podcast. If you like this episode, please subscribe on Apple Podcasts and Spotify. It would mean so much to me if you could leave us a 5-star review so more listeners like you could get this important information. See you next time.